Right, welcome in everyone. We are going to do some myofascial release work now, which is really just a fancy way of saying that we're going to kind of release the connective tissue in our body because it kind of gets stiff and stuck. And, we're going to start with the feet, which, is just, it will feel really nice underneath the bottom of your foot, and even releasing that fascia underneath the foot will have such a flow-on effect through the rest of the body, and particularly the pelvis. So you should notice a difference. And if you want, you can even, pause this video now, do a bit of a walk around before you do it to kind of notice how things feel, and then come back, grab a tennis ball, spiky ball. Generally they're the two things that you can use. The spiky balls, I think sometimes are a bit too much and can be, too grabby. So if you've got like a tennis ball or, some sort of smooth dog ball or something, they're probably much nicer on the system. You can also do this seated, but as long as you've got a wall for balance, then, I'd probably stand somewhere next to the wall. And really all we're going to do is place the tennis ball underneath the foot and just roll, just back and forward from the ball of the foot to the heel of the foot. And if you may find that there's some areas that, are more stuck and sticky than others, and you can stay there and kind of really get into that area. And again, work with the breath, because, it can be really tight and painful. So just ease off. So this is the other good thing about when you do your own release work, is that you have control over how much pressure that you are putting through that tissue. So it can be as gentle or as firm as you need it to be. And it kind of does take time depending on your lifestyle, if how much tension that you're carrying through there. So, don't be in a rush with this work. Take as much time as you need, and you'll kind of feel it when it starts to release. So, and doing each foot, and you'll feel a difference between feet as well. One foot might be, more sticky than the other. But like I mentioned, it's actually, running through your whole body. So what's happening in one part of the body is affecting other parts. And, I find most people, when we release the feet, you really notice a difference, through the pelvis area as well. And so when you've done that, you can have a little walk around, see how that feels. And then we're going to move up to the hip area. Okay, so now we're going to take our attention to the hip area, and we're going to use the wall for this. You can do this on the floor, but you can't control the pressure as much as you can with the wall, so leaning on the wall. So we're going to just pop the ball on the wall, and then you're just going to put your buttock area on there and just kind of roll it around, and you'll find spots. Maybe that's nothing for you, but just give it a go. And if that feels okay, you're going to just adjust again, and adjusting your stance. You can put more pressure or less pressure when you find a sticky spot, and you might just have to keep adjusting. So there, for me, it's a bit of a spot, so I might just stay there. And again, use the breath if it feels a bit too intense, but you can always ease off as well. And just gently rolling. And as mentioned, if we can break up, these adhesions and just release tension through that fascia, that's going to have a flow-on effect. And so we don't want to forget about the outer hip. So you can do both sides of, facing forward, more forward, but then we want to come to the outside, and there's generally some nice juicy spots here. And again, just rolling into that area. And when you find a sticky bit, just breathe, ease that pressure. Or you can lean into it a little bit more. You can even also just stop and put just stillness and put some pressure there as well. And just release until you kind of you'll feel the tension go. And that is how we can release our hip area on the wall. Now that we've done the hip, also a really easy spot that you can release yourself is upper back. So you want to put if your shoulder can manage this movement, you want to just put it into the sort of just next to the shoulder blade. For this one, you want to walk it out a little bit more so that you're leaning on the ball, and then you're going to just bend up and down and again, feeling where those spots are. So if there's a spot, you can go like side to side, just up and down, and then you might need to adjust a little bit higher. And again, just noticing where you need that release, using the ball, using your own tension, and as always, using the breath. You can put more or less tension here. And that's, again, that side to side movement can feel good. And we really want this to be, you know, a feel good thing. So you don't want to be pushing it so that it's painful. Like, it may be painful at the start, but just ease off and generally make it like a nice activity to do, not something that you want to avoid. And I think that that's why the wall can be a really useful tool. Because the floor can sometimes, we avoid those activities that really cause too much pain. So again, really gentle rolling movements there. There we go. And that's our useful tennis ball tool to release the fascia all throughout our body, from the feet, hips, and upper back.